Hi, everybody. I wanted to thank you again. A little bit of technical difficulties this morning. But good morning and thank you for taking the time to join the 2020 Homeless Awareness Virtual Conference. You're joining part 2 of a workshop titled Collaborating During COVID-19, Lessons Learned from Multi-Stakeholder Efforts. My name is Cecilia Fong and I will be your moderator for this workshop. We invite you to ask questions using the Q&A box during this discussion and hope to get through as many as we can. By the end of the panel, we hope you'll take away a few things, including what groundwork needs to be done for authentic collaboration to take place, how to overcome some of the classic barriers to collaboration, and a few ideas on how funders can support collaborative efforts. Without further ado, let's get started. As we were reflecting on the title of this year's conference, Moving Forward Together, we all know that in usual times, there is a great importance to work together. But amid a pandemic, we must actively and urgently seek those with a collaborative spirit who share our vision of solving our community's current and future challenges. The challenge of reaching and supporting our Pacific Islander community is no exception. It may come to no surprise that this year's 2020 point in time count reported Native Hawaiian and Pacific Islanders made up the largest homeless percentages and were 2.1 times or 210% more likely to represent homeless individuals compared to the general population on Oahu alone. And although we knew the vulnerability of this population, many months after the warnings of the spread of the coronavirus, it wasn't until the summer when the media began to highlight this community's need for our support. By August, Pacific Islanders represented nearly a third of the island's COVID-19 cases, even though they only make up 4% of Hawaii's population. Seeing what was on the horizon, I wanted to invite our panelists to share more on the organic nature of relying on trusted relationships and how they can lead to collaboration around common goals and identified opportunity. I'd like to welcome to our panel, Shanty Asher, the Pacific Islander Liaison Officer at the Office of Economic Revitalization from the City and County of Honolulu, Kanani Harris, a Strategy Consultant with Kamehameha Schools, Marisa Hayase, the Hawaii Program Director for the Harry and Jeanette Weinberg Foundation, Josie Howard, the Director and Founder of We Are Oceania, and of course, finally, Rachel Wong, the Founder and Strategic Advisor of One Shared Future. In order to dive right in, I invite you all to read their very rich bios in the conference booklet. Let's welcome our panelists. Josie, I'd like to ask you to set the stage for this conversation. Please share a little bit about your community and culture and what you are seeing when it comes to homelessness and now the coronavirus.
Good morning, everyone, and good morning to Cecilia and all the other panelists. Thank you so much for this opportunity. I want to start out with sharing my stories of coming to Hawaii and facing what is homelessness. I remember in 1989, my very first week in Hilo, going to our first picnic as freshmen at UH Hilo. Keokaha Beach, and I remember kind of wandering off and going onto the lava rocks and looking over to the break wall of Hilo Bay. And at the basement of that break wall, which was right behind where we were, our picnic was, were tents and looked like people were living in the tents. So I asked my new friends, what was going on, and they said, "Oh, these are homeless people." I've never heard homeless before. I come from a culture that homeless does not exist, even in our term. So I was really shocked. That was my first cultural shock, learning about homelessness. Anyways, life went on. In 2000, my oldest brother-in-law came to Hawaii. Just a little bit background on him. He fought the Vietnam War. He was probably one of the first Chugis enlisted in the US military. And I remember taking him on a cruise down Nimitz Highway, going into, Ala Moana Boulevard and down to Waikiki. And along that whole stretch, he was so amazed. And one thing he was like, "Oh my gosh, this is so beautiful." And then he's looking on other sides and he's going, "Wow, the spirit of this island must be very, very strong, powerful." And I remember thinking, "Oh, what do you mean?" And he said, "Well, there's all these people with mental illness standing around." That was his definition of what he was seeing. because he never understood they were actually homeless people like standing around. Back home, only the people with mental illness would wander off, and that you would see hanging out on the street or hanging out somewhere else, not having something to do because they're kind of excused. And so that was his whole definition of what he was seeing. And in 2006, that was my first time to sit at a key stakeholders meeting discussing homeless issue in Honolulu. And I remember feeling very frustrated when almost everyone who spoke from the different shelters were expressing how their shelters was full of Micronesians, and that there were Micronesians filling up all these homeless shelters. And I heard some of them, and I saw their gesture. They were not happy. They were frustrated, and I felt, wait a minute, this must be wrong. This can't be true. I just couldn't believe what I was hearing. That's actually the beginning of my passion in entering into working, doing social work in Hawaii. And I remember like thinking, no, this is not true. This is not our story. There's no way we come here because we want to become homeless. I know we all come here because we want a better opportunity, and there must be something. And I knew that the information was not right. In 2014, I faced with that even closer. My only sister, who came to join me in 2002 because of both renal failure, was close to facing homelessness, and I could not bear seeing a family member going homeless, and I understood what it will mean for her and for me, and so I had to take action, and it took the whole family to come together to think of how we could help my sister. And my husband and I had to rent a home under our name, risking I remember my boss telling me, wow, Josie, that is really ohana, because you're risking your credit and, in trusting to your sister, but that was the only way I could do it. And that led me to today, what we do, what we're doing for COVID. I feel like, this racial inequity, really during COVID, it came out even more evident. And in March of 2020, when the state closed down, we started to see our community coming to us, asking for certain need. And with our capacity, with one case manager on board, that was just it wasn't enough for and with no budget for supplies, for pampers, for food, for PPE, all those things that these people were coming to ask. Immediately we had to adjust. We had to stop and say, you know what, we need to collaborate. We need to reach out to our partners out there and see who can help us with supplies. And even without my reaching out to some people, we got people just, reaching out to us either in email or on our Facebook asking, Josie, I have this mask. Do you need them? They were just pouring out help from the community. And I remember, I just got into the media too in August, and I remember two fellows reaching out to me, and one of them is sitting with us today, Marisa, and the other one is Dr. Dara, and he gave 174,000 masks. We were able to use those masks up to October, from August to October, and when I look back on that, I was so amazed in just how much we could do, and not only the supplies we were getting, but when we were asking people for volunteers to help us, transport stuff or do our food drives that were donated. Our first food drives were all donated from individuals, organizations, churches, and people were coming to volunteer. And then we started to see that the trend of the need was people with COVID would call in, not the patients, it was their families who were calling in. And we're so worried about their family member and ask, can you help us? Where do we go to get tested? How do we talk to our employer? Are we going to get fired if we don't go to work because we're positive and we cannot get out of our house? How do we get food? So it was all of the information that the community was sharing that allowed us to come up with a way to help. And that led us to asking for support for the whole operation, because it became a huge operation. At one point, we even thought about maybe getting a hotel because a lot of people were just calling out. And so that led me to, Marisa, and I reached out to Rachel Wong in writing the grant. I mean, I'm not a good writer, so I knew that I had to rely on some people. So what I did, I just reached back to my, the people that I know in the community, and then they reach out into their resources, and that's how I met Kanani, and all of this, it all came together, and today we are able to. Last month we were able to help 420 some people on our helpline. From that, we were able to help 121 people that were quarantined at home and isolated at home. And all this collaboration was possible because, all of this work was possible because of this great collaboration. Thank you.
That's so great, Josie. And I love that through just your own networks and actually a very new network, you met a new friend. So I want to turn it over to Rachel to share, what was it like being on the other side of that phone call? And what did you see and what did you think you could do, and knowing there was such as this dire need in this community?
Sure. Thank you, Cece, and thank you, Josie, for sharing of your personal story and providing context that way. I wanted to provide a little more context in that, we all come into this room, whether we're on the panel or we're attending, and we bring our full selves and our experiences and our histories. And within this scenario, I brought, as the pandemic hit, experience leading Department of Human Services, where I had the privilege of working with some people who are in this room, and also meeting Josie and other leaders in the local Micronesian community, and going through some really tough times together. And because of, I think of the graciousness of local communities and continuing to work with those of us in the executive branch, I was at the time, we've been able to deepen our relationships. Kanani and I go back through college. Marisa, we met, I don't even know how many years ago. And so, as we all started reading about the disproportionality of positive cases, I think there was just within our consciousness, there was this idea of our interconnectivity and how we might all be able to gather around together. And so I look back at, I think I was driving on the windward side and I texted you, Marisa, and said, I'm coming by your house, want to come out and talk on the lawn? And from that, we were thinking the same things. Josie, we had our first conversation when I was driving back through the Pali Tunnel and saying, okay, here's some pieces moving into place. How might we work together to fill in gaps so that, our community statewide, is healthier. And then Kanani, I think you also reached out to me. I don't know which way. And, it was conversations on your end too. So I just really wanted to emphasize that, there's an organic nature that is part of collaboration. And that a big component of it is the relationships we bring, the openness that exists from past communications, from, whatever it is. And that, I think, is something that we can leverage and build upon in Hawaii because we are so interconnected. So this has been a great example.
So great. I wanted to bring Shanty into the conversation. Thank you for joining us. One, we're going to test out her audio, but also Shanty, you have a unique perspective too.
Well, thank you so much. I will say I greet you all in my native tongue. We say duo or Ming Sang Mao, that's in Pohnpeian. I am very honored and very humbled to be a panelist today with all this trailblazers, I would say, because all the work that they have done within the community, coupled with all the work that our community leaders and church leaders have done, enabled me to sit here as a Pacific Islander liaison, community liaison for the city and county of Honolulu. It's really the great work that all these volunteers and these leaders have done that enabled this position to happen. And I have to say that being a Pacific Islander representative at the city and county of Honolulu is truly an amazing experience. And I am very honored to have taken that role and be a voice on behalf of our leadership. When the pandemic hit, there were a lot of confusion, fear. But one thing I saw was that our leaders stepped in, as they always do, in a specific way to just offer support with whatever limited resources they had. They were just doing complementary role. And because we are Oceania and all these other nonprofits are doing their work as well, just like the state and city are trying to figure out how to best collaborate. I saw the community leaders were standing together to support with our topic today, talking about homelessness. I think one thing that was truly amazing was seeing all the volunteer work to support the people that have been impacted through unemployment and trying to help them with their application so that we do not increase that number, that challenge for within our community. Whatever resource, whatever strength that was available at the community level, they brought that in and they were really supportive wholeheartedly and compassionate to help the community. I think that it is through all this work behind the scenes that allowed the city and county and even the state to realize that that need is needed at the government level. So besides my role as the city and county rep, there are also now Pacific Islander teams being welcomed to support the State Department of Health. And these are all people that are within our community. Now they're just wearing a different hat to support at a government level. And these are all possible, like I said, because there are a lot of work that are being done. There are a lot of behind the scenes advocacy enabling all of this to happen today. And we truly hope that these collaboration with evident in the strengthened and new partnership within city, state, and our community, there is really great hope and appeal to each and every one of you out there who has a voice, who has power to advocate so that these work can continue on beyond COVID. Thank you, Cece.
Oh, thank you, Shanty. Yes, it's so terrific to hear that the government heard. I know sometimes we don't always have the best of news coming about our government, but I know your position was really, I think, a milestone, not just amid the pandemic, but hopefully moving forward as we approach community solutions. I want to turn to Kanani, and Kamehameha Schools is known very well for lifting up, especially the Native and Indigenous voice. What did you think, and see your role in this particular collaborative? We'd love to hear from you.
Aloha, Cece. Aloha, mai kākou. One of the things that Kamehameha has tried to do in the course of this pandemic is to, in addition to taking care of our primary kuleana, our primary area of responsibility with the schools, but we've also been looking, as we do in a lot of areas, at how can we support the entire community. And what we're talking about today is actually one example of multiple areas of collaboration that we've had regarding COVID. We have folks on our team who are collaborating with people who are doing research and data analysis about the Native Hawaiian and Pacific Islander impact. of COVID. We have others who are working with different groups to raise awareness and on a PR campaign and to collaboratively build tools to get the word out about prevention. This particular work that we're doing here, it was a little bit unique, and it was, we were recognizing that our American and our Pacific Islander brothers and sisters, they really are ohana, and we have a tremendous debt of gratitude to them for their contributions and their support of our community in very key ways over the last 40, 50 years. And so as we looked and we heard the data that was coming in regarding how the pandemic was hitting that community, the question came up at our executive level to find out, is there anything more that we can do? What specific things might we do? And at that point, I didn't have the connection. So my first call was to my good friend Rachel and said, hey, who would you point me to? Like, you know the community better than I do based on your prior work. And who might you suggest? And she said, the first person I suggest you talk to is Josie. And so thank you to Rachel for helping us make that initial connection. And by the time I made the request to Rachel, and by the time we had the first call, in the first call, we had garnered enough of collective momentum that there are multiple people on that call. And each one of us came not quite knowing what our role might be, but with a genuine desire to help. And so we walked into the room and listened to Josie and listened to the various needs that she shared and tried to kind of figure out what our role might be. And in some of these spaces, some of us are connectors, like I think Rachel's a natural connector. Others are grant makers. And other people can lend expertise. Right? And so when we walked into that conversation, it really was a humbling moment for each one of us as we listened. And, we're deeply saddened and affected by the stories that Josie shared and took it back and tried to figure out how we might be best able to increase the pace, scale, and impact of the work that was ahead of us. And so the specific role that we elected to support from the KS side would be to lend some technical expertise in the area of project management, because it was very evident from the first call that there was just a lot going on. Josie was a one-man show, and she was juggling calls and securing resources, securing funding. And so the best support that we thought we might be able to lend her was to give her somebody who could stand by her and kind of prop her arms up and give her the support so she could focus on the areas that needed her attention and not worry about the other details that somebody who didn't necessarily have the language skills or the connection to the community, they could work on. So that was the way that we chose to support. And I want to give a word of credit to our project manager, Ian Custino, who is a very skilled and talented member of our community team, and he just did a phenomenal job.
Thank you, Kanani. We know that each person plays a role, and perhaps formal or informally identified. I heard someone from the first panel say that know your role, stay in your lane, which actually just means that everyone has so much they can offer, but really, when is it most useful, right? When do we know when to lean in versus standing ready and waiting for our cue? So I'm going to ask Marisa, philanthropy can play such an important role in supporting our community efforts. So what do you think philanthropy's role is? And in this case, what did you think the role was? And also, what should funders be mindful of as we approach these, right? We're ready to guns blazing, right? But, I think you're incredibly thoughtful. So I'd love to hear how you approach this issue.
Thanks so much, Cece, and thank you everybody who's on this panel. And on behalf of the Harry and Jeanette Weinberg Foundation, I really want to thank everybody that's been a part of a collaborative approach to confronting some of the escalating challenges that we have here in Hawaii because of the pandemic, which is really just, as everyone knows, brought into sharp focus some of the community crises that have been unfortunately happening for a long time. And so with this sharpened focus, how can we have a clearer, coordinated response? And I think that's one of the opportunities in front of us. So on behalf of the Harry and Jeanette Weinberg Foundation, just want to say what an honor it is to be able to partner so closely with people like Josie and to not only support the Pacific Islander community, but support Pacific Islander leaders and build relationships and get to know them better and recognize the expertise that people have over their own lives, whether they're informal leaders or formal leaders, and that it makes us better grant makers when we're able to really hear those community stories, build those relationships, and think about our networks in a way that really brings our shared values to the forefront and helps us think collectively about what some potential solutions are that really elevate everybody's experiences and build from those. And so, I want to add to what people said, because a lot of this is relationship-based and values-based. But I think a lot of it can be strategic too. And for everyone that's attending this session, just thinking about some of those specific strategies people can employ. I also want to just mention and thank the Omidyar Fellowship Program, because it's through structures like that that really value the benefit of relationships and collaborations, and see that being able to build these relationships across sectors will really benefit Hawaii at large. It's a recurring theme here, and being in the fellowship program with Josie really shows how valuable structures like the Omidyar Fellowship really are, because it was that roster, we hadn't even met formally yet, that I had that let me just call her and say, congratulations on being a fellow, and can I ask you how things are going? I've been reading in the paper about the disproportionate impact of COVID on Pacific Islanders in our community, and would love to know if, just from the foundation standpoint, how we can best understand and support some of the community-based efforts and leaders. And so I think that structures like that are really important, and everyone can help design structures like this, can help design meetings and forums and community talk stories where we're really trying to learn from people with perspectives that are different from our own, and with experiences that are different from our own, and elevating stories, valuing storytelling, and the profound stake that we have in really listening to each other. A couple of other things, Cece, that I would mention in terms of just strategic things that I think people can do regardless of their roles, and especially in the funder community, are to really think through starting with young people that are exercising leadership. I think we hear a lot with communities that are stretched really thin, and really don't have often a lot of the resources and attention that is really warranted. Sometimes we hear, well, we just can't find enough volunteers, or we can't find enough qualified people. And I think we all have a role in creating that pool of people and providing compensation and providing paid opportunities and consultancies for people to really advise programs and advise effective programs for, in this case, Pacific Islander community members. And so I'm thinking about things like high school academies that have career academies for healthcare, for business, for natural resource management, and connecting with those high school academies and saying, can we look at student internships together? Can we get a sense of people that are underrepresented right now in healthcare professions and in other professions, and bring them in now and help expose them and help cultivate them and their leadership potential? And then the other thing I would say is, in addition to internships and work-based learning opportunities, is just something beyond one-time focus group, some kind of paid advisory council if you're a service provider that really wants to think about how to be effective partners with Pacific Islanders. I think that having those types of structures and advisory structures in an organization can be really valuable. So I think those are some initial thoughts, and thank you again to everyone here on the panelists and on the attendees side. Mahalo.
Thank you, Marisa. So much wisdom going on in this panel. I wanted to turn it back to Josie, because Marisa said something really important about lifting up and investing in really the future, these future leaders. The people on our call today, they may be leaders already and don't know it, but Josie, you are definitely seen as a leader in the Pacific Islander community, and you're the head of WOW, but also of the Pacific Islander. You represent a large part of the Pacific Islander community. So, can you share some things, for those out there listening, what can they do to either lift themselves up and be recognized as a leader, or how do we invest in your community to make sure that they have the capacity to continue leading your community?
Wow, that's a hard question. But I'm loving that conversation, because that is so true. In our culture, the word for youth or young leaders is Serefe. And we believe that they are the light of our islands, Haraman Fanu, which means the light of the islands. So I know WOW is truly invested in our rising leaders, our youth, starting from high school, middle school, recognizing that you know, Pacific Islanders, especially Micronesians, study has shown that there's a high dropout rates. We put together what we call the Micronesian Youth Summit that has been happening over the 4 years, and really to empower our youths and to make them know that they are the light and they are the people who are going to take over the baton from me and from Shanty and from, you know, the existing leaders right now. And I'm very happy and excited to say that, you know, when we call out for volunteers, the first volunteers were actually youths that came forward. And, you know, like Marisa said, I look at that and I thought, you know what a way to empower these youths. If we get funding, let's compensate them, because, you know, their time is worth, and we want to make sure that they feel valued and they feel worth it, and they are a big part of this whole movement forward. So that's what make possible with the city and county, I mean, the city funding, we were able to hire on those first volunteers who were youth. So if you come to WOW's Food Tribe, you'll see a lot of young people, you know, very excited. And, you know, that grind is coming to an end. And so when I talk to them personally, they all express how happy and fortunate they are just to be part of this short-term service to the community, and how proud they are to be there helping their and giving back, the word they're using, giving back to their community. So I think, you know, for service providers out there, there are many of these people, and you may even come to service some of them and empower them, use their skills, and recognize that they are actually asset to your program.
I love that. And I wanted to turn it over to Shanty to share a little bit more. So, you know, we want to see more of our youth in every facet of our community. And the fact that you're in the government, not just working with government, but in government, you know, share a little bit more about that role and what you'd like to share with our youth, you know, about seeing someone from their community in your role, I think is amazing.
Empowerment. I think that's really the one thing that all of us strive to do right now with all this partnership and all the youth summits that WOW has incredibly hosted for the past years. It's really creating that strategy, that pathway, not only from school, not only right now, but in their future. One component of the Compact of Free Association is, one is to seek better opportunities, and that's really opportunities for employment and school. So with the partnership that I have, you know, I'm very honored to share this stage with these really powerful representatives, because I think it's really getting our youths to know that they have so much potential. And in doing so, how can we come up with strategies that are continued and systematic? And we do that, there's going to be more inspiration. They will have this embedded in their plans. One of the most important things that is still not known and common knowledge to a lot of our kids, because back home, we're guided through our counselors. It's small units that we have those counselors that attend to us. Here, a counselor is actually responsible to one counselor is about 250 students. So how can we create a group where these kids know that when they go there, they can get a pathway, a clear future that they can build for themselves and know about FAFSA, that all of this, because finances is one of our biggest challenge within our community. So how can they know that these are there and then build a future around that and not say that I do not have money, college is not going to be an option for me. So with the government, maybe building that in, now being a board of education member, that's really one of the priority areas that we're really trying to push for and advocate for, to provide more inspiration and guarantee that there will be options for these kids. And, you know, I think being a Micronesian and a Pacific Islander working for the government and city and county is a big thing. It's not my achievement, it's all our achievement. And that's the thing that will empower many of these kids, that we can do it. And we are an asset. We are an asset. So with the current, with many of them still trying to feel empowered and confident in their potential, we can just build that out, and then they will get there. They just need role models like Josie, mentors like Josie, and help to reposition our support to get these kids together and equality within the representation, because all understand that we have 3 COFA nations, and within one of those nations are 4 states. We also have to build equity within those opportunities for our kids. Thank you.
Sorry, your words are so powerful, and I hope you realize you're a mentor too, Shanty. We'll definitely look up to you and your role, and see that you are achieving so much for your community. I want to piggyback a little bit off of what Josie said and turn back to Marisa. We have a question from the audience saying, can you explain why you feel a paid advisory group provides better structure than an unpaid advisory group? And I think this is always one of those, foundational questions. And then I'm going to pitch it to Kanani, because I bet, Kamehameha Schools has some thoughts too.
Sure, I'd be happy to answer that question just from my own perspective. And this is from, a couple of decades of experience working in community and economic development as both a consultant and as a nonprofit executive director. And I think that where I land on this is based on the idea that real engagement, when we're paid professionals that have a paid job to deliver excellent programming that really makes a difference in communities, that when we ask for numbers of community that have been severely impacted by structural racism, by concentrated poverty, by really structures that keep power imbalances in place, that a paid structure is a way to somehow say, we value you as a consultant and an expert advisor in this situation, regardless of titles, regardless of educational background. There is a lived experience and expertise here that we can only get from someone who's actually very close to an understanding of what would best work in a community. And so that is the case I would make when we did statewide focus groups with some of the efforts, cross-sector efforts I was involved with. We always tried to make sure to pay people for their participation and their time. And it's one way to say, you're valued in this. However, I have seen recently, some pushback on this, because it's really, it can be considered a token as well, and can just be also, perpetuating inequality just in the level of compensation. And so that's why I mentioned, maybe beyond one focus group, really thinking about building relationships over a long term, and thinking about, what do we pay consultants for in other fields? And does this not apply to, say, a better understanding of some of the conditions and challenges, as well as strengths that we can invest in with our Pacific Islander neighbors? So those are some initial thoughts, and I'd love to, and I'll watch the chat. I'd love to continue the conversation, because it's by no means something that I think we have all figured out. There's a great article, and if I can, I'll put a link in the chat box, from the Urban Institute about community building and engagement in communities that have been historically marginalized and traumatized. And I think, we haven't talked about this much here, but it goes without saying that, one of the reasons why we have disproportionate impact with COVID is just the underlying health conditions and the responsibility, that we have in that as the United States to really consider that and to think about how we now go from here in a way that really builds some equality and equality in the stories that are being shared. Thanks.
Yes, go ahead, Kanani.
Hi, Cece. Actually, I was intrigued when Marisa suggested that I made a note to myself that I should follow up with her to get her ideas. To the best of my knowledge, and I certainly don't speak for the entire organization in this, we have not made a habit, or we're not in the practice of paying community stakeholder groups to give us their input. It might occur that I'm just not aware of, but what we do on a regular basis, and I know this because when we were doing our strategic planning community sessions, and we had over 30 community meetings on every island. We make sure to feed the people who come to give us their mana'o or their input. We'll feed them dinner because they are giving of their time. And that's not quite the same as what Marisa was describing, but I think there is a genuine recognition that when people donate their time and expertise, there are some nice gestures when you have the ability, but not everybody has resource to be able to do that. And so that might be a constraint for some of our attendees, but it has been a gesture that has been appreciated by folks when they come. And frankly, a lot of our community groups, they're alumni who are eager to give back. So the dynamics aren't exactly the same, but it's certainly an idea that I jotted down and Marisa mentioned it.
Can I add this, Josie? I just want to add from a indigenous perspective that this is a practice of our core value of reciprocity. We as Pacific Islanders, that is one core value that we practice. And whether we're talking about money today, but in our olden days, when an uncle brings fish, we give him back taro, or there's that exchange. And, when you share something of your mana'o, it should be honored and should be respected, and you give that back in a form of another way. And so what Marisa is talking about is transforming that into monetary usage, or in this world's value. But I think for me, I find that very difficult when people come to volunteer for We Are Oceania, or I see our community very active out there. I'm so proud of it. But at the same time, if it's under We Are Oceania, I feel obligated that I have to do something in return. And of course, the way of doing that in the funding is not allowing me, unless I have some flexible funding that I can pay for food or something like that. So I think maybe that's what Marisa is also implying. I don't know, but that's my understanding from my perspective in listening to that and the value of that. It's valuing the people and their expertise and their service. Thank you.
Thank you, Josie. Yes, go ahead, Rachel. I'd love to bring you.
I'd like to build on what everyone has shared here about relationships and reciprocity. And, I had talked about the relationships that we bring into this room, and Marisa talked about how we might create structures and systems to nurture these relationships. A lot of the work that One Shared Future does is create the space so that people can come together and recognize that there are old ways of doing things, and we have scar tissue from the trauma of past interactions. And what I've learned from working with Josie and now Shanty and with the Pacific Islander COVID group, is the way of serving each other. And so what I wanted to offer here is that, so much is about our learning to or trying to understand others' perspectives. So whether it's reciprocity, or recognizing that I just wanted to put out there that those who work in government agencies, and Shanti, thank you for being there, much of it, is the calcified structures in which people work. And that, there's the feds, there's the legislature, there's the media, there's the community that exerts pressure. And so however we might come to tables together through mutual invitation, and with this idea, as Rachel Naomi Remen writes about, and if anyone wants to look her up, she's the author of Kitchen Table Wisdom. The way she talks about reciprocity is, oftentimes we look at fixing, helping, or serving. And then when we say, I want to fix something or someone, that means we're looking at the situation or the people or the communities being broken. And so it's this kind of dynamic. When we look at helping, then we're saying that you are weak and that let me help you. And I think when we talk about reciprocity, it's how might I serve? And so if we were, to all come back to this shared commonality that this is the first time in all of humanity that we're experiencing something that is globally affecting us, and we're all connected in this way through technology, we have this shared living experience, and how might we all serve each other regardless of what place we come from, because we're all humans. And so it's that perspective that we're working with different departments. And when we go back to paid advisories, one thing that we're working with departments is in the state is that they're actually taking their funds and giving it to the community and community leaders and organizations and saying, we don't have the expertise, and we recognize that you folks are the ones in the community, so you take it and run. So that's another way of doing that. Thank you.
Thank you. And that was perfect. I was going to ask you just to share a little bit more about your current work, knowing all of the wonderful history experience you also bring. We have a few more minutes, and so I do invite, if anybody has any other questions, I'll try to get a few more. But, collaboration is not linear. It's not clean, right? It's, come in with a plan, a blueprint. Can you share a little bit about how you approach some of the messiness? What are those barriers? What are those pitfalls? And how do you kind of persevere? I'm going to couch this in the question that, with all the wonderful efforts, the Native Hawaiian and Pacific Islander community did see a decrease in the COVID positive testing to about 27, 28%. But recently they've been ticking up a little bit. So, what do we need to do again together to make sure that we're addressing this? What more can we do to make sure we're impacting the efforts and making them follow through?
Are you looking for any of us to jump in?
Yes, sorry. That was a very open-wide question. Go ahead, Rachel.
I can just share that, and I don't represent any state agency. I can just share that there's conversations, and Shanty, you can build on this if you want, that there is recognition that, there are increasing numbers, and and I'll just say this, it's been very, very reaffirming to be working with Department of Health right now, and for there to be this tone and philosophy of public health, and this affirmation of public health means meeting the community where they are. And so I hope that folks will see that there's going to be more and more offerings to the community saying, what is needed in order, from one's own community or communities, what is needed in order to share messages about safe practices and actually what's needed to gather safely and to live in culturally appropriate ways. So it doesn't quite address anything. I'm not representing anyone, but I'd like to share that.
I want to add to that. I think, empowering the grassroots level is really, really important, and recognizing that PI is not homogenous. It's not, it's not one culture, it's not one language, and recognizing that when we look at the data, disaggregated data, and we see Chugis, or we see Marshallese, or we see someone Tongan, we must go to that particular community instead of addressing it to one huge group, because that can also, it can lump everything together, and we may not be able to reach the core, the root of that community that we need to reach in order for information to transfer quickly, and also information to be situated with the receptive to the community. There's one thing about having the information, and there's another about being receptive to the information. So I think from me, that's something that came out from yesterday's Hawaii Hawaii Civil Rights Commission hearing, and in recognizing each community as unique and with their own way of communication, with their own way of receiving information. Thank you.
Thank you. Kanani, Marisa, Shanty, do you want to share anything on the messiness or the...
Yeah, if I can just say something. So there was a question the other night, because I attend as a city, as a Pacific Islander community liaison, with the partnership I have at the grassroots before I joined the city, I now join these meetings as a representative to hear the challenges that continue to occur within each communities. And this is a group of church ministers that come together every Tuesday at 8 p.m. And I really respect all of this. This is a time when they can rest, but they see how they can further the discussion. And I welcome the contact tracing team, who are all Pacific Islanders, to go and talk to them too. So they know, so they can go back to their own communities and tell them that these are the developments. We now have a Pacific Islander contact tracing team that when Auntie Josie was saying earlier that within this aggregated data, use it to have community leaders reach out within their own community. And this is to see how they can best serve. And the question that came up was, how come there are of people that are helping, but the numbers are increasing? One thing that the contact tracer said is because there may be more trust in coming out, getting tested, knowing that these resources are there. So what usually happens, they did a role play, like one of them call and try to contact one of the ministers and try to speak their own language. And that is in itself so valuable, and it gives so much respect in that process. So now there is trust that even if DOH is calling me, I will be hearing someone from someone that is familiar to me. So there is all this work that are done at WOW with their helpline, and now with the contact tracers and me, it's all connected right now. So there is more trust, but the question is, how can we bring more messages that would impact decision in coming together? It is still a challenge. So how can we approach that in a very respectful but family-based message, that if you continue to gather, more of your families will be at risk? So I think things are happening, and there is so much respect to the system for recognizing the value that these communities bring to the table. And so I just wanted to say that there are a lot of resources now that complements the work of We Are Oceania, and all of this are really helping the community as a whole in its entirety.
Thank you, Shanti. So I'm going to quickly just go around. I know it's noon, but I was going to start with Kanani. If you can give us just one piece of advice as we close this session and for people to take back as they really approach their work with a collaborative lens.
I think it would be to be very intentional about developing meaningful relationships in a broad way with folks who work outside of your sector. I think it's really, I think everyone who's on the call probably has a fairly healthy network within their sector, but it's really important to have folks who work with a completely different group of people, because that network, as it starts to mature, can be very helpful when you have that trust.
Rachel, how about you? What would be one piece of advice?
Just simply is find the highest commonality and the shared goals and center on that.
Marisa?
I put in the chat to identify and and move away from a deficit framework. And to Josie's point of this is not true, this is not our story. What is, and what are those strengths, like the youth that are the light in your community, and how do we help grow those strengths? So that would be my parting words. Thank you.
Shanty, any words of advice?
They said it all. Thank you so much.
Josie, I want to give you the last word. What would be your piece of advice to this very diverse and wonderful community and all of them, everyone listening?
I want to piggyback on everyone's comments and bring it together, weave it together. Relationship, understanding the roles within those relationships and honoring those roles and empowering those roles.
Thank you, everybody. I also wanted to just share that on behalf of American Savings Bank, we believe that you should just truly trust and trust your relationships. That's how we got involved, and that's how we definitely wanted to support through a financial grant to We Are Oceania, is that we trusted. And so explore trust-based philanthropy, explore those relationships. When this is all done and over, all those cups of coffee, and happy hours, they all pay off in the end. But again, I want to thank everybody for joining us. Thank you to all of our wonderful panelists. I wanted to invite you all back to the main site where they're going to have the closing plenary. But again, thank you and have a wonderful afternoon.
Thank you, Cecilia. Thank you,
everybody.
Thank you, everybody.